So tonight's topic, what you can eat after weight loss surgery. I think a lot of people want to know this, especially if you're thinking about having weight loss surgery. A lot of times for my patients, they're always amazed by how little they can eat. Like I tell new patients to look at the palm of their hands, just the palm of their hands, your hand. That's all you'll be able to eat or try to eat at one sitting when it comes to having weight loss surgery. For my patients, it's mostly the sleeves. I do a lot of sleeves, gastric sleeves. And so the volume amount is quite shocking for them. But a lot of times they also want to know what they can eat. And that's the point of this broadcast. Now, I know it sounds a little bit ridiculous, but after weight loss surgery, here it is, ready? After weight loss surgery, you can eat whatever you want. And that's the truth. You can eat whatever you want. Now, whether you lose weight or not, that's a different question. You can eat whatever you want. You might not lose weight, but you can eat whatever you want. And that's the truth. All right? You know, like my last Periscope, I talked about why there was no right or wrong. Any action you choose to do, it's okay. You just have to be able to live with the consequences. And it's no different after weight loss surgery. If you decide to have weight loss surgery, you can eventually, if you put your mind to it, eat anything you want. Now, whether you lose weight or not, depends on what you eat, right? So you can have ice cream after weight loss surgery, you can have cake after weight loss surgery, you can have chips, you can have junk, but you won't lose weight. Promise you won't, okay? And you have to live with those consequences, okay? And that's really important because I think for some reason new patients or revisional patients, they think there's some secret formula. You know, Dr. Vuong, just tell me what to eat. Well, I can tell you what to eat, but doesn't mean you'll eat it. No, Dr. Vuong, if you would just give me a food calendar and tell me what to eat every meal, I could do that, but there's no guarantee you would eat it. Because I hear that quite a bit, you know. Dr. Vuong, can I eat this? Will I be able to eat this after weight loss surgery? Can I have this? Can I have this? Can I have that? Yeah, you can have all of that. You might not lose weight, but you can have it, you know. And that's the real truth of the matter. And that's what weight loss surgery patients need to understand. There's no magic to the surgery that's going to make you stop eating junk. Even bypass patients who get dumping, they will still eat sweets and suffer dumping. Does that make sense what I'm saying? Your mind is so powerful. So even though they know they're not supposed to eat cookies and they get dumping, they'll still eat cookies. Does that make sense? So for me to sit here and tell you, you have a bypass, don't eat cookies, doesn't mean anything once you leave my office. You could leave with like all the printed out material. You could watch Periscopes till the cows come home. You could read all my books, read all my materials. I could make you a beautiful food calendar with all the, you know, I could give you the best recipes with the best cookbooks ever. But it doesn't mean you're going to do it. Does that make sense? So surgeons are a little bit slightly confused on this subject. And dietitians also. You know, we do our best to give you guidelines on what you should and should not eat, but ultimately it's up to you to do what you should do. I'll give you examples. Lap band patients sit there and say, well, I can't really eat bread. But do they? Yeah, they eat bread. They suffer the consequences. It'll get stuck. They'll throw it back up, but they'll try to eat it. Every now and then, something will stay down. But they'll try it. Same thing with sleeve patients. They'll keep eating a little bit more and more and more, you know, stretch out that sleeve. Same thing with bypass patients. Eat a little bit more and more and more, stretch out their bypass pouch until the day comes when they can eat a normal volume, you know. But at the end of the day, that doesn't really matter because what you eat has got to have changed. Should have changed, right? So it was kind of a tricky topic, tricky question. What can you eat after weight loss surgery? The answer is anything you want. You just have to be able to live with the consequences. So the first Periscope I did, the last one was, there's no right or wrong. You just have to live with the consequences. And the other one before that was how to be successful with anything in life. Remember what I told you? You have to do the right thing, and you have to do it for long enough. And this is where I want to tie it in for my weight loss surgery patients. To be successful with your weight loss surgery, you have to do the right thing for long enough. And when it comes to weight loss success and your health, it means for the rest of your life. Because if you don't do it for the rest of your life, you're not going to have much of a life. And you're not going to have much health. right? So if you want to be successful, you got to do the right thing and do it for the rest of your life. That's it. I can talk all I want, teach you everything I want, but you have to do it. Cool? That's it. That's what you can eat after weight loss surgery. Now, for some people, that's really scary. You're probably sitting here listening to this going, that's stupid. Why would I have the weight loss surgery then? And that's a different topic. Don't confuse your topics. The topic today was what you eat after weight loss surgery. And I'm here to tell you can eat whatever you want, because your mind will make it up. Your mind will make up whether you can keep it down or not. That's up to your mind. That's between you and your head. All right? And you need to understand that. So you got to get your head under control. Cool? We'll talk about all the other stuff later. But if you're approaching weight loss surgery, then you need to know you can eat whatever you want after weight loss surgery. You just have to live with the consequences. And if you pick the wrong stuff, you're not going to lose weight. You're not going to have the results. You're not going to have the metabolic effects. So, all right, do the good stuff. That's my 10-minute talk.